Hello, good afternoon. Oh, please don't worry, I'm here. It is some technical problem we have today. I hope you can hear me clearly. Yes, I just see only 12 students today. Seems it is it is not enough, but what we can do? Let's start. Yes. Please let me know how do you feel? How do you hear me? What is the connection? Is the connection good? Well, hello. Nice, very nice. So today topic is torso muscles, and we start from the presentation, and this is the issue of our lecture. We will not be able to have information about upper and lower limb muscles, but we will talk about next lecture. Today we just limited with the muscles of trunk, torso muscles, and you see that is typical. This is a typical bodybuilder, a typical athlete who has very good muscles of the torso. And what is the torso? What does it mean? Torso, as you see, this is the part of the body. If we cut the neck and upper and low limb, we will have only torso. That is the central part of our body, quite large, and this part has got few group of muscles. I would like also to say about the meaning or the reason why we have separated lecture about trunk muscles. First of all, this is of course aesthetic aspects. You see, when the muscles of the trunk is good shaped, and this, I think it is quite attractive, and it is not shame to be topless like a man, and even this is when we go to the beach and see good shaped body in the when people keep shape of their body, it's very attractive. Please and see, this is a small details here I noticed yesterday. This girl has a place after surgical operation. Maybe it was appendectomy, so it is interesting. And of course, functional aspect of the muscles, because they provide a lot of movements of our spinal column. It is also the reason why we talk about trunk muscles, because they support posture, our posture, and give for all our movements the plastic. And as this girl, very interesting girl, she is a champion, world champion in the special body gymnastic. And by the way, she is from Russia, but lives in Germany now. Muscles of the trunk form the wall of the chest, and of course the wall of abdominal cavities. Very important function is that all muscles of the trunk, especially abdominal muscles, help to our internal organ to do what they should do. I mean, this is the urination, bowel movements. For the chest, muscles of the chest muscles help us to breathe, and other function what we will see later. Most of the trunk muscles are static muscles. Maybe you remember that we last lecture we talked about myelin, a special element of muscles. So mostly all muscles in our trunk have myelins with a lot of muscles fibers. It means it is a static muscles which can be strong, but they are awkward. So it is also some of future about functional muscles. And of course, when we talk about trunk muscles, we see that is a lot of clinical aspects, because every doctor should assess of muscle development during external examination and see what they are in hypertrophy or hypertrophy or norm, in the norm state. Also, we assess of muscle tone during examination of our belly or abdominal region, because very often when we feel the strong or higher tone of the abdominal muscles, we think about some pathological process inside of our belly. It is very important. And also another clinical aspect of trunk muscles is because it shows the result of the total function our spinal cord and with all of muscles. And sometimes we see such a pathological kyphosis, and here this is a scoliosis. This is S-shaped scoliosis, and usually it is a result of the disease or some kind of abnormal development, or sometimes is a result of neurological diseases. So it is very important muscles in our body, and we need to evaluate and assess them in our activity. A couple of words about development of trunk muscles. Let me ask you about how you can hear me now, because sometimes we have problems with the internet supporting, because a lot of students now come in internet. This is the period when we have examination, some examination, and please let me know. Everything is okay? Hello? Well, good. Fine, thank you. So let me continue, and a couple of words about development. Mostly all organs and tissue in our body start from two derivatives. This is a dermatome, myotome, and sclerotome. This is a two derivatives which are on the this is a three derivatives, but when we talk about muscle development, we mean this layer we call myotome or myotome in Latin, and it go in different direction, and from this derivate from this embryon layer, all of our muscles are developed. And here you can see the cross section of embryo 4 weeks. It is only small part, small derivate for myotome. When we take a look of cross section of 5 weeks embryo, we see that the myotome is enlarged, a little bit enlarged, and then more and more and more, and here we see that it is divided for the posterior part, here to posterior part, and this is the origin, this is the myotomes, what gives us the back muscles, and anterior part of myotomes give us the chest muscles, abdominal muscles, and even upper and lower limb muscles. And you see how it is come to the back, and this is the back muscles here, two group, of course right and left group, and here you see expanding of ventral myotomes, and all of other muscles in our trunk come from this mostly part of. Here is visible the dividing in some layers. Usually in abdominal region we have 3 layers. It is we'll see. And this is another picture of 5 weeks old embryo, and you see myotomes here. This is a 5 weeks, so they are not divided into ventral and dorsal part, but in 8 weeks we see there is a back muscles intrinsic. They is dorsal myotomes, and here visible all of these stripes, all of these lines are ventral myotomes, and you see the limbs also come from the ventral part of myotomes. What about dorsal muscle classification? The muscles we can see on the dorsal part of our body we call back muscles, because they are located on our dorsal, on our back. And another muscles in our body are located on the ventral part, and this is the upper group we call thoracic or chest muscles. Lower group in our belly, in abdominal region, we call abdominal muscles, but this is only one muscles between thoracic cavity and abdominal cavity, and we call this one diaphragms or phrenic muscles, musculus phrenicus in Latin. These muscles come from the part of the it comes to the body from the neck and located between very deep inside. It is like membrane, like a thin layer of muscles. We see it. So start now. We will talk in details, in more details about muscles and fascia of the back. First of all, the back have the upper line or upper body. It's here. It comes from the processus spinosus of cervicalis vertebra 7 and go to the acromion, to the acromion, and the low or below board come of on the ilium crests and sacrum. So this is a big part of our body, dorsal part we call back. Take in consideration that the occipital region here, this region, usually when we talk about this region, we think about neck, not back, not the back, but this is our neck region. But some of the muscles come from the back to this region. So we teach all of these muscles in one lecture. And you can also see some back areas or back regions here. First one here is a long region. It is located near the processus spinosus of the spinal column here. It is long and central region. Second one is the suprascapular region, or radius suprascapularis in Latin, because it is located up to the scapula. The projection, scapular projection, is number 3. It's the scapular region. 4 is subscapular region. It is under the scapula, and this is the lowest part we call lumbar, and also the most lowest, lowest part is sacral region. It is projection of the sacral. This is directly to the shape of the os sacrum. What is the classification of the back muscles? We have only 2 groups here. Superficial muscles, they usually move our upper limb bones and help us to move with our arms. And another one, they attached to the ribs and move ribs when we breathe. And deep muscles have about 3 layers. It is really a lot of muscles here, so we divided them on 3 layers: superficial, intermediate, and deep. And you see that by the origin we have ventral origin of the muscles. It means they come from the ventral myotomes, and dorsal origin. It means they come from the dorsal myotome and innervated by posterior branches of the spinal nerves. And actually 2 muscles come from the bronchial arches, and this is only 2 muscles, and they innervated, of course, by the 11 pair of cranial nerves. This is a nervus accessorius nerve. And let me show you some of superficial back muscles. First is muscles, very good muscles, and it has the shape like trapeze, so it is a we call it in Latin musculus trapezius. And second one is also in superficial layer. This is musculus latissimus dorsi. I will call all of these muscles in Latin because you have to know Latin names. Under the trapezius when we cut musculus trapezius and see the muscles which we call musculus levator scapulae. This is muscles which move scapula up, and this is usually in our country when somebody asks you but you don't know what to answer, you just move this way and move your scapula up, and it means I don't know. So sometimes we call these muscles, this is the muscles for the, this is muscles what usually is is the good shape and very strong for the students who doesn't know anything. So it means this is for not good students. Another 2 muscles is the rhomboid muscles. One is small, musculus rhomboidus minor, and the big one here is musculus rhomboidus major. And two muscles what attached to the ribs. This is serratus muscles, posterior, inferior, and under the rhomboid muscles we can see when we cut rhomboid muscle, we can also see the serratus posterior, superior muscles. Usually musculus serratus posterior superior, this is when we breathe up, this is the function of musculus serratus posterior superior. But when we breathe out, we use this muscles, serratus posterior muscles. Deep muscles, superficial layer. This is the 2 splenius muscles. They are really like a belt, and they are named splenius because in Latin splenius means belt. Splenius muscles have two parts. This is splenius capitis, musculus splenius capitis, because it come from the processus spinosus and attached to the skull. And the second part is musculus splenius cervicis. This is the cervical part of these muscles. And two very, very strong and very good muscles here we call musculus erector spinae. This is big and all here. This is large muscles in our back. It lays in superficial position and has got three parts. The first lateral part we called iliocostal muscles here, iliocostal. Second is musculus longissimus here. It is the intermediate. And here is the medial part we called musculus spinalis. So we can divide it, musculus erector spinae, on the three parts, musculus iliocostalis, musculus longissimus, and musculus spinalis. Let me repeat that these muscles is very, very strong and large, and we can see these muscles not only in our back. Some of its part come on the neck region. And here, this is the intermediate layer of deep muscles, deep back muscles in our trunk. Of course, you can see here musculus multifidus or musculus multifidus. This is the muscles come. It is the intermediate layer of musculus transversus. This is quite big, also quite big muscles here. We call it in common musculus transversus spinalis, but it's divided on musculus semispinalis. Here is musculus semispinalis, cervicis, capitis, cervicis, and thoracis. And under musculus semispinalis we could find musculi multifidi, and under musculus multifidi we could see musculus rotatoris, small one. These muscles help us to turn right or turn left when we move our body. When we this is a special movements we call torsio in Latin. When our lower part is stable, but when our shoulder we move left or move right. It is like a spring, and usually we use all of these muscles to do torsio, and the deep layer of deep back muscles. This is the muscles between processus transversus and between processus spinosus, here and here. Usually it is not very big muscles. We can see they in the movable part of our spinal column, in cervical part and lumbar part. Here is also. This is the musculi intertransversaria, and here musculi interspinalis. We usually couldn't see these muscles on the thoracis region because thorax is quite stable part of our body, and these muscles are not visible. But you can also see the muscles we call musculi levatores costarum. This is the muscles what come from the processus transversus, from here to the ribs, and of course these muscles help us to breathe. They move our ribs up when we breathe in, and these muscles relax and we breathe out. And don't forget also to study only these four muscles. They are very, very deep muscles located in the neck region, or the nuchal. We call it nuchal region or nuchal muscles. This is usually muscles which move in two articulation between first and second cervical vertebra, and between first cervical vertebra and cranium. Usually we can see them when we cut all of other muscles, and they are very, very deep. And we can see first one is musculus obliquus capitis inferior. This one is musculus obliquus capitis superior, and two rectus muscles. Small, we call musculus rectus capitis posterior minor here, and longer, musculus rectus capitis posterior major. All of these muscles help us to rotate our head, right or left, and also to flex your back and flex your towards. Usually back, because two of these muscles, rectus capitis posterior minor and obliquus capitis superior, they make flex your back or back flexure of our head. Couple of words about fascia in this region. We have two fascia, superficial and propria, or sometimes we call it individual fascia, and it has personal name fascia thoracolumbalis. As you see, they have three layers: posterior, middle, and anterior. It is better. It's better. It's the best vision we can see on the cross section. Here is the posterior layer, and it comes to the superficial muscles like latissimus dorsi, etc. And this one is the intermediate layer or middle layer here, and anterior layer come here, and it is cover one of the muscles in the abdominal region here. So don't forget that the individual or propria or own fascia of back muscles we call fascia thoracolumbalis. Couple of clinical anatomy. Between musculus latissimus dorsi, one of the muscles in abdominal region, we call it musculus external abdominal, musculus obliquus external abdominal or external oblique muscles, and from the lower body, this is a crest, and this is a triangle we call lumbar triangle, and this is the weak part of the abdominal wall, and sometimes this region we can find hernia in this triangle, or sometimes in this. So this is a site of abdominal hernia. And for doctors also, you should know the place what is best for auscultation. When we would like to hear the breathing sounds, breathing, I mean when lungs influent with air, we can hear the breathing. The best place to do that is the triangle we call auscultation triangle. This is between the musculus trapezius and musculus latissimus dorsi. So if you need to hear your breathing or the breathing of your patient in the future, please put your stethoscope in this position, and you can hear well everything. Next group muscles. This is the chest muscles. What is the borders? The upper border of this region is jugular notch, and then to the upper edge of clavicle, and this is a border between neck and between the chest. But the lower border is the border of horizontal line under the base of xiphoid process. So only this region we call chest. You see some of small region here. I don't want to repeat it because you can see and read about that in your textbook. Classification of chest muscles. We have two groups of this muscle. First one is muscles attaching to the upper limb bones. This one. Next, it is this. This is usually, there are 4 muscles in this group, and they help us to move our arms. But second group is the group attaching to the ribs. Here, this is a small. Usually we have about 5 muscle groups here, and as you see, all muscles in our chest have ventral origin and innervated by the anterior branches of spinal nerves. What kind of muscles in the first group? What attaching to the upper limb? Of course, this is a very good muscles we call musculus pectoralis major or pectoral major muscle. Under this one muscles we can find pectoral minor or musculus pectoralis minor. The third one is muscles we call serratus muscles or musculus serratus anterior. In the back we had musculus serratus posterior, but here is musculus serratus anterior. And the small one, very, very small, this is the fourth muscles here, we called musculus subclavius or subclavian muscles. So it's only 4 muscles here. 1, 2, 3, and 4. Okay, what about chest muscles attaching to the ribs? Usually between the ribs we have 2 groups of muscles. This one we call musculus intercostalis externi. They are located out. but under them we could find another muscles intercostalis, we call musculi intercostalis interni. Usually they are antagonist muscles, because musculi intercostalis externi move when we breathe in, but when we breathe out we usually move in musculi intercostalis interni. In other muscles we could find on the inner side of our anterior wall of the chest, and this one we call musculus transversus thoracis, because their bundles have in the lower part a horizontal direction. And also we could find some subcostal muscles here. Subcostal muscles usually help in breathing in, and they come through one ribs and attach to the another ribs. So usually in this group we could calculate 1, 2, 3, 4 muscles, but 5 muscles is located in the outside. I showed these muscles when we see back region. Okay, fascia here has 2 big fascia. Superficial fascia, it is under the skin, and for women, in female, it covers the mammary gland, like here. This is the superficial fascia, and it is under the skin. Second, in individual fascia or fascia propria, it has 2 layers: superficial layers, deep layers. It covers the subclavian muscles and musculus pectoralis minor. And the third layer we call thoracic layer. It is between musculus pectoralis minor. Here is pectoralis minor, here is pectoralis minor, and between pectoralis minor and ribs we could find thorax layer of individual fascia. And inside of the thorax, inside of the chest, we could find the third fascia named endo-abdominal fascia. Endo-abdominal, because not endo-abdominal, this is a mistake. Endothoracic fascia, endothoracic. It lines inside of our chest and isolated our ribs from the pleural layers. It is also for soldiers. We show 3 triangles in the chest. First one is trigonum clavipectorale, between clavicula and upper border of musculus pectoralis minor. In projection of musculus pectoralis minor, we could find trigonum pectorale, number 2, and the lowest between lower border of musculus pectoralis minor, we could trigonum subpectorale, or in Latin trigonum subpectorale. So it is usually necessary to know for surgeon who who operates this region. Diaphragm, this is the phrenicum musculus, what help us to breathe and see. It is located between our abdomen. Abdomen is down, and up is the pleural cavity. So this is muscles come here from the neck region and located accurately between thoracic and abdominal cavity. Usually it is asymmetric because of the liver, and right dome, right part or cupule is this level, but left dome, where we could find under this dome, we could find stomach, and you see this is a difference between two domes, and usually inside of the diaphragm or musculus phrenicus we could find three apertures for aorta, vena cava, and esophagus. Here is three apertures. This one is the aperture for aorta abdominalis here. This is the esophageal aperture. Esophagus comes through this aperture, and in the centrum tendinum, this is a part of diaphragm without muscles fibers. You see, it is a white part, because there are no muscles fibers. We call centrum tendinum or central tendon of diaphragm, and in the centrum tendinum we could find the aperture for vena cava inferior. This is the vena cava inferior, and this is accurate in the centrum tendinum. Muscles part or muscles bundles of the diaphragms consist of three parts. Small one here we call sternal part, pars sternalis. The biggest part of diaphragm we call pars costalis, because it is attached to the ribs, and the dorsal part of diaphragm we call pars lumbalis, because it's connected to the lumbar vertebra. So if you will be asked how many parts have diaphragms, you are the three: sternal, costal, and lumbar. It is also some triangles, but it is weak. This is the weak points. And it is possible to have a hernia in these triangles here, for example, or here. But mostly common situation when we have hernia in the esophagus aperture. Usually this is the weakest point of the diaphragm. And yes, and the function of diaphragm, of course, it is breathing. It's the breathing. When our diaphragm is contracted, we breathe in. When it is relaxed, we breathe out. Usually, women use diaphragm more than men in breathing process, because men use the muscles in the chest, external intervertebral muscles and muscles levator, costarum, etc. But women usually use more diaphragm in the breathing process. And the last group of muscles we have to study today, this is the abdomen muscles. It is quite a big region between the line, horizontal line, through the base of xiphoid process, and inferior line come on the iliac crests. Inguinal ligament, here is a big ligament here. This is the lowest border of the abdominal, and we call this ligament inguinal ligament. Very important ligament here. And the lateral border is on the posterior axillary line. It is on our lateral side. And usually doctors have to know all of regions in abdominal. Usually we have three big regions: upper abdomen, mid abdomen, and lower abdomen. We call sometimes this part of or upper abdomen we call epigastrium in Latin. Mid abdomen also called mesogastrium in Latin, and the lowest compartment we call epigastrium, mesogastrium, and hypogastrium. Here is hypogastrium. But by two lines with mid-clavicular lines, it's divided on nine parts. This is the epigastric region here in central part. Epigastric region, umbilical region, and pubic region. This is in pair regions, but pair regions is hypochondrial, left and right, lateral or lumbar region, left and right, with number 5 and 8. And in hypogastrium we could find inguinal region, right inguinal region number 9, and left inguinal region number 6. Classification of abdominal muscles. Abdominal muscles by location could be divided in anterolateral group. Anterolateral group. This group has long muscles and broad muscles. And another one is posterior group. The posterior group has only one muscles on the back wall of the abdomen, on the back abdominal wall. And by origin, all abdominal muscles come from ventral myotomes, and they have also so they have ventral origin, innervated by anterior branches of the spinal cord. What kind of muscles we will talk about, and you have to know all of them. First one, this is external oblique muscles, or in Latin musculus musculus abdominal musculus, sorry, this, I'm confused with Latin and English. Musculus obliquus abdominis externus in Latin, and it is in their direction, the bundle direction is the same as serratus muscles and the same as the external intercostal muscles. Under the external oblique muscles, we could find here internal oblique muscles here, and you see that there's fibers have the same direction as internal intercostal muscles. Here, direction of internal intercostal muscles, and here is the direction of musculus obliquus abdominis internals or internal oblique. This is the broad muscles. Of course, they have broad ligaments we usually call aponeurosis, and this aponeurosis come to the central line and have connection here. It is visible, and we call this connection of aponeurosis linea alba. Linea alba is a part of the abdominal wall where we mostly couldn't find any vessels, because vessels come from the lateral side, and usually surgeons use linea alba to cut anterior abdominal wall, and it would be without blooding, no blood, because this is almost no vessels, no arteries, no vein. And another broad muscles is under the internal oblique. Here you see the three layers: external oblique muscles, internal oblique muscles, and another muscles in the lateral wall we call transversal or transversus abdominis, transversus abdominis muscles, or musculus transversus abdominis. It is also has aponeurosis, which makes posterior layer of rectus sheath. This is a special covers or special compartment for rectus abdominis muscles. Rectus abdominis muscles is also on the anterolateral position. It is a big muscles between the ribs and processus xiphoid, and between the pubic region, between the os pubicum, and usually it has several segments. It is visible here, and these white segments where there are no muscle fibers, we call sectiones intertendinae or tendinous intersections, and usually 1, 2, 3, about 4 or 6 such segments, and all fibers of musculus rectus abdominis is covered by aponeurosis. It is visible here. Aponeurosis of broad muscles come from the anterior position, and also come to the posterior position. And here the compartment we call rectus sheath. It is special compartment for musculus rectus abdominis. And sometimes we could find very small muscles. Here we call pyramidal muscles. Pyramidal muscle, musculus pyramidalis in Latin, and this is a reduced muscles, and it's only help to tense the linea alba. Here linea alba is very good visible. Here is the upper part of this linea, and this is the lower part of this linea, and between them we could find the umbiculus. It is a place where usually where umbilical cord come into the body in the embryo period, and which brings we use umbilical cord embryo use to change the chemical between the mother body and fetus body. Okay, here this picture we can see only one muscle on the posterior group, and it calls musculus quadratus lumborum, or quadratus lumborum muscle. This is between the 12 ribs and crest of ilia crest, and it is in anterior position to the back muscles. And here you see the diaphragm, or musculus phrenicus, which is connected to the musculus quadratus lumborum. Fascia abdominalis. In the chest we have three fascia: superficial, under the skin; individual fascia, three layers: superficial for the musculus oblique muscles of the abdomen, and intermediate between musculus obliquus abdominis externus and internus, external and internal broad muscles, and deep layers cover the transverse abdominal muscles, so it's three layers. And we could also find endo-abdominal fascia. This is a fascia as in the chest region. It is located on the inner surface of abdominal wall, and in other, this is a quite big fascia and have a different part. In some region it called transverse fascia in abdomen, diaphragm fascia when it is lies on the diaphragm, iliopsoas fascia when it is on the same muscle, and pelvic fascia, etc. Okay, and a couple of topographical formation in this area. Very important formation we have in the inguinal region, and it calls canalis inguinalis, inguinal channel. This is a sport-like space located between muscles abdominal wall, and usually it contains spermatic cord. Here is spermatic cord for men, and for women it is ligament, round ligament of the uterus, or ligamentum teres uteri in Latin. We teach this channel because it is a good topographical point, and sometimes here is visible the inguinalis channel. Here it contains for male the spermatic cord, and has usually the channel has usually 4 walls: anterior one, superior, inferior wall, and here is the posterior wall. So spermatic cord located between 4 walls, and sometimes here is possible to find a inguinal hernia. This is a negative meaning of this channel, because sometimes it happens when hernia comes from the abdominal cavity through the inguinal channel, and usually it needs to operate these people who have hernia, because it's danger situation, because of sometimes through the hernia come intestinum, and sometimes it's closed between the muscles, and this is a process very negative. Okay, and I'd also here is visible the hernia process. It is just linea alba. It is also be the place for hernia, abdominal hernia, and it's visible small hernia in linea alba. Especially we could find such hernia after big surgical operation, when surgeon cuts linea alba, and then after sometimes maybe 2 or 3 or 5 years the fibers is damaged, and hernia started between aponeurosis, and this is a problem, especially when intestinum come into this sac, and sometimes it is a string or has a strangulation, and usually it is a very bad situation for people. So don't forget just to study inguinal canal, linea alba. This is a weak point of abdominal region, and don't forget also to be informed, to read more about the rectus sheath. This is the rectus sheath, as I show you. Please read more about how it is made with aponeurosis. It is interesting, and I'd like finish now today, and because the time is over. And this is a very good picture of Russian painter. I like this as well. And I would like to ask you come back to Moodle, and please do the exercise of test after this lecture. This is a test for some group of our torso muscles. Okay, this is all for now. And please I'm not sure we will have lecture next week, because we have holidays, long holidays from the 1st January till 8th January, but I hope we will meet here and for another lecture on, let me see, it will be I think it will be 11 January. So I wish you Happy New Year. Thank you for congratulations. I also congratulate you with the Happy New Year. I hope next year will be better than 20th year, and I hope you have a possibility to come here and we start our regular lecture and regular classes. Thank you very much, and bye, my friends.